Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and today I'm going to discuss about Crohn's disease, a type of inflammatory bowel disease, and that is because of your requests. And as you know, all my videos are directly referenced from the internationally accepted US National Medical Library, so you can trust the information given in my videos. So stay tuned guys. Today we are going to debunk everything there is to know about Crohn's disease. I'm going to tell you what are the causes, the symptoms, the options available, diagnostic tests, the treatment, the possible complication, any surgery, the prognosis, everything would be covered today. So stay tuned and don't forget to subscribe and hit the bell icon.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, Crohn's disease is basically a disease where the part of a digestive tract becomes inflamed. So your digestive tract is inflamed, and it mostly involves the lower end of the small intestine. There is two parts, small and large intestine. So small intestine, lower end is inflamed, is involved, and sometimes the beginning of large intestine is also involved. So that is the most common part. But yes, it can occur in any part of the digestive symptom, from mouth to the anus. Any part can be involved. It is also associated, related condition is ulcerative colitis, and this is a form of inflammatory bowel disease, IBD. What causes this condition? Why your bowels will get inflamed? The exact cause is actually unknown. It occurs in the body because of the immune system, right? Because our own immune system mistakenly attacks and destroys the healthy body tissue. That is autoimmune disorder, yes. And this can happen because of a reaction to many things, anything, quite frankly. So you had to understand, when a part of this digestive tract becomes swollen, inflamed, what will happen? The walls of this digestive tract intestine will become thickened, right? So there are many factors, right, which play a role why you might have this disease, this problem. Obviously your genes and family history play a role. People who are having this condition mostly have one close relative, right, who has had such a problem. Environmental factors play a role. A lot of environmental changes, extreme temperatures, there is a lot of adulteration in the food, then the tendency of your body to overreact. And one big factor is smoking. Yes. So this problem can happen because of all these things collectively, and sometimes only genes are one big factor, right? It can happen in any age, and mostly it happens between 15 to 35 years of age. And when it happens, it can have a lot of symptoms, and symptoms will obviously depend upon which part of your intestine, of your GI tract is involved. Right, it can range from mild to severe. Symptoms can come and go. You can have periodic flare-ups also. So the main symptom obviously will be cramping pain in the belly, right, in the belly area, in the middle of the stomach. So that will be the main symptom. Along with that, you might have fever, fatigue, loss of appetite. Then you might have weight loss. You might feel that you need to pass stool even though your bowels, your intestines are already empty. You might feel the need to pass stools, right? It may involve, right, straining, pain, cramping, right? On the other hand, you might even have watery diarrhea, and which might as well be bloody. Blood in stools. So that can happen. And sometimes constipation can also happen. Sometimes there might be other systems involved, like you might have swelling and soreness in the eyes. You might have joint pains and swellings, mouth ulcers, right? You might have swollen gums. You might have tender red nodules under the skins, right, which may turn into skin ulcers, right? And even sometimes you might have draining of pus or mucus or stools around the rectum or anus, right? Not from the rectum. Stools are coming out around from a fistula around the rectum or anus. Right? Sometimes pus comes out from there, sometimes mucus. So it's basically fistulas can form. So these are all the symptoms which can happen due to Crohn's disease. So how can you diagnose it? Obviously, a physical examination is needed, and if a doctor does, sometimes we find a mass, sometimes we find tenderness in the abdomen, sometimes skin rash, swollen jaw, joints, mouth ulcers are found, right? And we do tests. Tests involved colonoscopy, CT scan of the abdomen. So we can do capsule endoscopy. There is a test called upper GI endoscopy, or barium studies can be done. So depending upon case to case basis, tests are done. Sometimes enteroscopy is done, MRI of the abdomen is done, a stool culture is done to rule out other possible causes of the symptoms, right? Like possibly larva or parasitic infections, right? Then you might need to do some more tests, blood tests like albumin levels. You might have low albumin levels, right? High ESR rate, right? You might have fecal fat, more fat in your stools. You might have low blood counts, low hemoglobin or hematocrit because of losing a lot of blood, right? Abnormal liver blood counts can be there. Then high white blood cells, right? WBCs, fighting cells, can be there whenever there is an active infection. Like elevated fecal calprotectin. Calprotectin levels are also found in the stools, right? Elevated in this thing can be there. So these are all the tests which indicate that you have this problem. So your doctor, basically a gastroenterologist, will evaluate this condition and then diagnose whether it is Crohn's disease or not. And whenever if you have this problem, then management is a big step. I mean, it's a long process. It's not a matter of a few medications or some limited time of treatment. It's a long process. Lifestyle has to be changed. Diet and nutrition has to be changed. You need to eat a well balanced diet, a healthy diet which should include enough calories, protein, nutrients from various foods, right? There is no specific diet which has shown that okay, this will only benefit or this will make it worse, right? And it varies from person to person. Some people can have a reaction or bad effect due to certain types of food, some might not. So you have to see for yourself which kind of food gives you relief, which kind of food causes you problem. Some food can make diarrhea and gas worse, right? If this is happening, what can you do? You can try eating small amount of food throughout the day, and you can try drinking a lot of water. Drink small amount of water throughout the day, right? That's the good plan. Avoid high fiber foods, like these are not good for you with this disease. Bran, beans, nuts, seeds, popcorns, they are not so good, so avoid them or keep them limited. Avoid fatty food, greasy food, fried food, right? Sauces, butter, margarine, heavy creams, right? Avoid all these things, right? Then you can limit dairy products, right? If you have problem digesting these dairy fats, right? This is again person to person variation is there. Some people can digest that, some people cannot handle it. So you need to try that. If that is happening, you can try low lactose cheese, right? Such as cheddar cheese or Swiss cheese, right? And sometimes an enzyme product such as lactate can be given, which can help to break down lactose. So that is one thing. Then you can avoid foods that cause gas in your case. Like, for example, that can be beans or certain types of vegetables like cabbage, family vegetables like broccoli. So that is again case to case basis. If that is causing problem with you, stop those things, right? Then your doctor can give you extra vitamins, extra minerals, right? You might be given iron supplements, right? Because you might be losing blood, so you might get anemic, so you'll get iron supplements. You might be getting calcium and vitamin D supplements to keep your bones strong, vitamin B12 to prevent anemia, vitamin D obviously to absorb calcium. Then a big factor is stress. You may feel worried, embarrassed, or even sad and depressed about having a bowel disease, but stressful event in your life such as losing job or moving out or losing a loved one, all these, any kind of major stress can actually worsen your problem. So try to avoid stress, live a stress free life, get a good sleep, right? Ask your doctor for tips how to manage stress, or you can watch my video on anxiety and stress, right? Then medicines, coming on to medicines, you can take medicines to treat bad diarrhea. If you have diarrhea, only then medicine called Imodium or loperamide can be taken without a prescription. Yeah, you can buy this medication without a prescription. This basically slows down your bowel movements, so relieve your diarrhea temporarily. And you need to talk to your doctor. Always try to talk to your doctor before taking any medication, no matter if it is an over-the-counter medication or not. Then certain other medication which would help your symptom would be fiber supplements, right? Obviously, you need to take less fibers, but a little increasing fiber, progressive increasing fibers will be beneficial. You can take supplements like psyllium powder, right? But you need to ask your doctor whether you need to take any laxative or not, right? For that, then Tylenol, acetaminophen, basically paracetamol. You can take this medication for mild pain, right? You don't want to take any other non-steroidal anti-inflammatory drug like aspirin, ibuprofen, naproxen, right? Nice, nimesulide. Don't take any other painkiller except paracetamol, right? Acetaminophen. Your doctor can also prescribe you other typical medication for Crohn's disease, which are 5-amino salicylates. These are medication that help you control mild to moderate disease symptoms, and some form of this drug are taken orally, others can be given rectally also. Then steroids, because it's an autoimmune disease, steroids are very helpful, but needs to be taken for a very limited amount of time, only when your doctor prescribes it, if you have actually a moderate to severe disease, right? In that case, prednisolone is given by your doctor, and in that they might be taken again by oral route or inserted anally, right? Medicines can also be given to suppress your immune system reaction. Then if you have fistula and there is an abscess, there is pus, then antibiotics will be needed. That will be decided on per case basis. And then obviously immunosuppressive drugs can also be given. There are many options. For example, Imuran, 6-MPs, many other drugs are available which your doctor will choose. Biological therapy can also be used for severe Crohn's disease. These are used in people who do not respond to other types of medicines. Like many similar medications, similar line of treatment is there, just like rheumatoid arthritis. Basically, both are inflammatory conditions, so that's why treatment is little bit similar. So you can watch my video of rheumatoid arthritis also. Then why would you need surgery? Some people with Crohn's disease may need surgery to remove a damaged or diseased part of your intestine. In some cases, the entire large intestine needs to be removed, with or without the rectum. If rectum is removed, then you will have a ileostomy, a hole in the stomach from where your poop is coming out. So people who have Crohn's disease that do not respond to medication, only they need surgery, right? And how would you know that you are not responding to medication? You will have constant bleeding, you will have failure to grow. I mean, in cases of children who have this problem, growth will be stunted. I mean, they will not show growth. Then fistula, if you have fistula which is not healing, if there are infection, if there is narrowing of the intestine, right, in that case, then surgeries can be done. Obviously ileostomy, as I said, is a one part. Then some part of your large intestine or small intestine can be removed, and removal of the complete large intestine and rectum can be done. So that's the surgery. And if you talk about prognosis, unfortunately there is no permanent cure. There is no permanent cure for this disease. The condition is marked by periods of improvement followed by a flare-up of symptoms, and Crohn's disease cannot be cured. Even after surgery, you will have to live with it, and you have to learn to live with it, but you can cope. There is a possible thing. You can cope with it, you can learn to live with it, you can manage it. That's the thing, right? And if you fail to manage it, then you might land up into complications. What are the complications? There is a risk of abscess in your intestine. There is a risk of colon cancer. There is a risk of anemia because you are losing blood. Bowel can become blocked, so you might have constipation. Fistulas can actually join your bladder and your intestine. Then fistulas can come out through the skin, can go in vagina in females. So fistulas can join intestine, your rectum, into all these things. Then if you're a child, you might show slow growth and there might be slow sexual development. Then you might have swelling in the joints, lack of important nutrients like vitamin D, iron, problem with maintaining weight, then swelling in the bile duct that can happen. So all these things are possible complications. So you need to talk to your doctor, and especially if you have very bad abdominal pain, if you cannot control your diarrhea with diet changes and even drugs, if you have lost your weight, if your child is not gaining weight, if you are bleeding, you have a lot of soreness, a lot of diarrhea, if there is a fever for more than 2 to 3 days, high grade fever for 103, 100 and more than 101 degrees basically, so that can be there. And if you have nausea, vomiting also lasting for more than 1 day, then also you should go to a doctor. Obviously, if there is any side effect of the medication, you should obviously talk to your doctor. So that is all about everything you need to know about Crohn's disease, which is basically the medical recommendation which I have explained to you. So as I said, Crohn's disease is also called inflammatory bowel disease. It is also called regional enteritis, ileitis, granulomatous ileocolitis, or sometimes plain simple Crohn's disease. So hope you enjoyed the video. Don't forget to subscribe and hit the bell icon for many such videos. Soon I am going to post a video about ulcerative colitis also, and many other such videos. So stay tuned guys, stay connected, stay healthy. I'm Dr. Paramjeet. Those who don't know me, I'm a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR. See ya.